The progress we've made in ensuring children have health insurance is slipping away fast. Child uninsured rates have climbed to their highest level since 2014, and this trend demands urgent attention. Every year, we dive into the rich data from the U.S. Census Bureau's American Community Survey, ACS, which offers the most detailed national and state-by-state insights into important factors affecting American families, including health insurance coverage. Just yesterday, fresh data for calendar year 2024 was released, and we've analyzed it closely. Our focus zeroes in on the health insurance status of children 18 years and under across all 50 states and the District of Columbia, covering the period from 2022 through 2024. During these two pivotal years, states completed the Medicaid Unwinding process, a unique and unprecedented event in Medicaid history. This process ended the continuous coverage protections put in place during the pandemic, requiring states to reassess Medicaid eligibility for tens of millions of beneficiaries. But here's where it gets controversial. Many of us feared that a significant number of eligible children might lose their coverage unintentionally during this unwinding, particularly in states that did not handle the process with sufficient care and precision. Why is this such a concern? Because children qualify for Medicaid and CHIP at much higher income levels than adults. Nationally, children's median eligibility sits around 255% of the federal poverty level. When large numbers of kids lose coverage, it often indicates these children are mistakenly removed due to procedural errors, not because they lost eligibility. We closely tracked these patterns and identified substantial state-to-state differences in how well they manage this unwinding, a variability that's clearly reflected in the new data we're examining now. Before diving deeper into the numbers, let's take a moment to understand why children having health insurance is so critical. Sometimes policy debates imply that health coverage might not be essential. But for nearly all American families, except maybe the ultra-wealthy, there's no need to debate this. No parent wants to worry about how they'll afford a doctor's visit or medicine for their child. Healthcare costs can be astronomical, and even a brief lapse in coverage can mean financial devastation. Imagine a playground accident or an asthma attack requiring emergency care. That can easily lead to medical bills in the thousands. This isn't just common sense. Research shows that Medicaid coverage for children leads to better access to health care, improved health outcomes, higher educational achievement, and even greater economic success in adulthood. It's a wise investment for taxpayers too, as highlighted by the Congressional Budget Office. Not having insurance doesn't just mean a lack of coverage. It guarantees stress and missed care, which only leads to worse health and higher costs down the line. Simply put, children, families, and society at large thrive when children have reliable healthcare access. Historically, reducing the number of uninsured children has enjoyed broad bipartisan support. Looking at longitudinal data, insurance rates steadily improved for years following the creation of CHIP in 1997, and even earlier. Medicaid expansions in the 1980s under a Democratic Congress and then President Reagan significantly reduced uninsured rates for poor children. But from 2022 to 2024, we witnessed a disturbing reversal. The percentage of children without insurance rose from 5.1% to 6%. This increase is statistically significant and translates to an 18% jump in the number of uninsured children nationwide. This marks the highest child uninsured rate in a decade, and alarmingly, evidence suggests this trend will continue worsening. This reversal undermines years of progress towards better child health coverage. This rise in uninsured children spans across all racial and ethnic groups except Asian children, whose coverage remained stable. Interestingly, adult uninsured rates did not rise during this period, and eligibility criteria for children stayed constant. It's also crucial to emphasize that most uninsured children are eligible but simply not enrolled in Medicaid or CHIP. Looking more closely at states, 22 saw noticeable increases in their uninsured child populations over these 2 years. Only one state, New Hampshire, bucked the trend by reducing its uninsured child rate by 1.1 percentage points, a commendable feat deserving recognition. The rest either showed minor, statistically insignificant shifts in either direction. The state with the most alarming numbers is Texas. Its Medicaid Unwinding process resulted in 1.3 million children losing coverage, far more than any other state. The child uninsured rate in Texas surged from 10.9% to 13.6%, a 29% increase that left 1.1 million children uninsured in 2024. To put this in perspective, nearly a quarter of all uninsured children in the U.S. live in Texas. If every state had performed as poorly as Texas, the nationwide jump in uninsured children would have been even more severe. Following Texas, Delaware and Idaho tied for the second largest rise in uninsured children, followed by New Mexico in fourth. Arkansas, Kansas, South Dakota, and Georgia closely trail these. The other states with significant increases include Alabama, Colorado, Oklahoma, South Carolina, Tennessee, Florida, Ohio, Washington, Michigan, Missouri, New Jersey, Virginia, North Carolina, and Massachusetts. In terms of sheer numbers, Texas leads enormously with an additional 246,000 uninsured children, followed by Florida, 67,000, and Georgia, 48,000. Here's the part most people miss that sparked controversy. States that have not adopted the Medicaid expansion for adults experienced much greater increases in child uninsured rates which were already higher than in states that expanded Medicaid. This finding is critical, especially because during recent congressional debates over H.R. 1, some advocates argued that cutting adult Medicaid expansion was necessary to protect traditional Medicaid groups like children. Our data clearly contradicts that claim. In fact, children in non-expansion states are faring worse compared to those in expansion states. The only exception is New Hampshire, an expansion state which saw improvements. Moreover, supporters of Medicaid cuts claimed that non-expansion states should have focused on children since they make up the biggest Medicaid group there, yet they didn't deliver better outcomes. Could this be a sign that political decisions, rather than budget constraints, are driving these outcomes? Geography is becoming an increasingly important factor in whether a child has insurance. Medicaid enrollment rates closely track with uninsured rates for children, and how states managed Medicaid unwinding, including their speed and success in automating re-enrollment processes, substantially shaped these results. Looking forward, the prospects are troubling. While this 2024 data is concerning on its own, we have strong reasons to predict conditions will deteriorate further. One silver lining helping to contain the rise in uninsured numbers has been the growth of subsidized marketplace insurance for children. Although still small compared to Medicaid and CHIP, marketplace enrollments among children under 18 have more than doubled since 2020, buoyed by enhanced subsidies enacted in 2021. However, these enhanced subsidies are set to expire at the end of the year. Without congressional intervention to extend or renew them, these gains are at risk, and we could see a surge in uninsured children once again. Another chilling factor comes from the political climate affecting immigrant families. Approximately 1